Good morning, wise men. Last summer, my wife Pat introduced me to Dr. Paul Epstein at the Senior Center. He was lecturing on self-healing, and I found his words stimulating and illuminating, even humorous. Today, Dr. Epstein's theme is seeing with new eyes. He's a naturopathic physician with 30 years of experience in mind-body therapy and mindfulness meditation. Dr. Epstein was born in Manhattan. He was raised in South Bronx and Little Neck, Long Island. He's been in Fairfield County for about 30 years, in Westport for the last 7 years. He has a BA in social psychology from Stony Brook University, and he graduated an ND degree from the National College of Naturopathic Medicine. Dr. Epstein has developed innovative courses and programs in holistic medicine, stress and lifestyle counseling. He's a core faculty member of the Graduate Institute Master's Program in Experiential Health and Healing. He has lectured internationally on mind-body integrative medicine and is licensed in Connecticut and practices in Westport. Please join me in welcoming Dr. Epstein.
Good morning. Good morning. So in the time we have, I'm going to be sharing a few stories from my practice and sharing with you how I came to be this way as the kind of physician that I am, helping people in self-healing and the healing journey. I'm going to talk about integrative medicine, but I'd like to start with a case of a client that I saw that's fairly typical, but I think it fits this audience better than most. It was a gentleman that came to me after he'd been through a number of other clinical attempts to treat his condition. He had psoriatic arthritis, which is a combination of a skin disorder of psoriasis and arthritis. And it's a genetic predisposition that a person may have to have whatever ailment they have. He came to me. He had managed it for the past 20 years through his dermatologist and getting the appropriate creams and lotions, as well from his rheumatologist and various medicines and anti-inflammatories and painkillers. But what managed it best was going to Florida. Or if he had been a member of the Wise Men, it would be joining one of the clubs and hanging out and having fun, which, by the way, is very good medicine. So I just want to acknowledge that standing here and listening, sitting there and listening to all of the wonderful things that you guys do is the kind of medicine I practice, is to get people to do those things. That's actually what helps you stay well and stay healthy. But what helped this gentleman was going to Florida twice a year to play golf, to lay in the sun, to go in the ocean. And it worked. He would go down there, his skin would clear up, his arthritis would clear up. He'd come back and get back to life and to work and stress, and sure enough, his symptoms would act up again. He'd go back to his dermatologist and rheumatologist, except this time, he went down to Florida and he came back, and for the first time, it didn't work. It didn't clear up. It was worse than ever. And so one of the things I do in mind-body medicine is ask people, what's going on in your life? What are your stresses? Is there a mind-body connection? There's a phrase we'll talk about, how your biography becomes your biology. And we integrate this into the healing work that he's already doing. This is not in place of medicine, instead of doctors, conventional physicians, instead of whatever else. This is kind of adding in the ingredient that may be the most important for change and healing to happen. And when I asked him, so what's different this time? I mean, what happened? This time when we went to Florida, it didn't work. And he said, I took my wife. Stress. Now, sad but true. Sad but true. That's the nature of the beast. And the nature of the beast is not that his wife caused the arthritis or the psoriasis, but the stress in his relationship by itself aggravated it, exacerbated it, was making it worse. And in the 20 years he was treating, he wasn't dealing with the one issue that was in his face, that if he faced it and dealt with it, healing could have happened. Now, the challenge here is He didn't want to face it and deal with it. He wanted to go play golf. Now, my work is, I don't have any magic cures or quick fixes or instant pills. I mean, I'm a good doctor and meditation teacher, and I can help people relax. But if they want to heal and change, I have to help them look in the mirror. Last night I was up late, and I'm sure you guys know the show, To Tell the Truth, right? That's pretty much all I practice, is help people look in the mirror and tell themselves the truth and face some issues that, you know, they want to avoid. Why do they want to avoid it? Because it's painful. But then, if the pain of not facing it becomes greater than the pain of facing it, eventually they face it. Did anybody see the movie Nixon? Yeah. No. What happened with Nixon? The cover-up, the cover-up, the cover-up. All he had to do was admit, right? But it's so hard for people to face the truth. But when they do, it's a liberating experience. We had, what's his name? A-Rod, right? Finally, I'm sure a big weight's lifted off his shoulders. There's another phrase to share with you. The body bears the burden. Where does it go? You know, where does it go when we don't forgive? When we hang on to aches and pains and hurts and wounds? And eventually, sooner or later, our bodies carry it. Our body remembers what our mind and our heart tries to forget, but it lives in there. So I've become an expert at helping people look inside themselves and make a choice to face the truth, however difficult it is, in a positive sense of healing, positive sense of letting go. You know, when people have faced those issues and they ask, and as we age, it's kind of like, well, what didn't I accomplish in my life? Remember that movie, The Bucket List? Yeah. Okay? And it was kind of like, you know, what I want to say to you now in the science of mind-body medicine as a doctor, that's medicine for people. That's just as much medicine, and there's just as much effect as any medicine that you're going to take or the surgery that you're going to do. I brought in a book to share with you, and I'll talk about it in greater depth. But Dean Ornish, medical doctor, did research, and he wrote a book, Reversing Heart Disease Without Drugs and Surgery. Okay? That's Dr. Dean Ornish. And at first, he focused only on exercise and diet. Changing your diet, lowering your cholesterol, low fat, Pritikin kind of things, exercise, fitness, etc. It wasn't until he added in the mind-body connection and stress and emotions that he could make the statement that you could reverse heart disease. That the mental emotional component of his treatments became effective only when the emotional piece was added in, which is people healing their lives. What does that mean, healing your life? It means I always wanted to be a teacher, but I've been a corporate lawyer my whole life. So I become the teacher and my life heals. Or I always wanted to do photography. Or I need to forgive the daughter I have in California that is angry at me because I wasn't there when she was growing up. Or whatever the issues may be, facing them have profound effects on our emotions, and our emotions have profound effects on our body. There is a mind-body connection. The first thing you learn in medical school is the hip bone is connected to the thigh bone. And from my standpoint, the mind is connected to the body. The heart is connected to the body. So we talk about treating the whole person. I wanted to share with you one or two stories that will further illustrate what I'm saying about healing. And then we'll have a discussion and Q&A. How I learned about this is I was a graduate of the college and I was a resident in preventive medicine.